All right, everybody, we'll call this meeting to order at 12:31. Roll call.
Dave Gordon,
Here.
Beth Hassett,
Here.
Olivia Kasiri, Bruce Wagstaff,
Here.
Scott Moak,
Here.
Phil Cerna, Donna Sneringer, Steve Wertz,
Here.
Lee Turner Johnson,
Here.
Kathy Kossick,
Here.
Terry Porter,
Here.
Christina Elliott, Patrick Kennedy, and, Scott, you're here? Okay. Beth Hassett will be the chair of the meeting today with Phil Cerna being out, and Kathy Kossick will be voting since Dr. Kasiri is out today. And there's so many out, wait a minute. Okay. This meeting of the First Five Sacramento Commission is cablecast live on Metro Cable 14, the local government affairs channel on the Comcast Consolidated Communications and AT&T U-verse cable systems. This meeting is closed caption and webcast at www.sacmetrocable.tv. Today's meeting will be repeated Wednesday, December 4th at 9 a.m. and Thursday, December 5th at 6 p.m. on Channel 14. Members of the audience wishing to address the commission may sign a speaker slip at the kiosk located in the back of the room. Please include the agenda item number that you wish to address and then bring the completed form to me. Please speak into the microphone when addressing the commission and state your name for the record. If you have any electronic devices, please put them on silent or turn off now. Thank you.
All right, Commissioner Moak, will you please lead us in the Pledge of Allegiance?
Gladly.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Approval of October 7th draft action summary.
Have a motion to approve?
I'll move approval.
Thank you. Second?
Second.
This isn't roll. Is it a roll call?
Dave Gordon,
Aye.
Beth Hassett,
Aye.
Kathy Kossick,
Aye.
Bruce Wagstaff,
Aye.
Scott Moak,
Aye.
Patrick Kennedy.
Aye.
Motion passed. Public comments?
I don't have any slips, nor do I see anyone coming. The next item.
Executive Director report?
Good afternoon, Commissioners. I hope you all had a wonderful Thanksgiving. A couple highlights for you. Before we jump in, I wanted to just take a minute to introduce Lindsay. Lindsay is our newest member of the commission, of the staff of the commission. Lindsay Dunkel joins us from First Five Nevada County, where she was executive director for about 12 years. We're very happy to have her, and I'm sorry I forgot to introduce her at the last meeting, but if anything, it shows she survived her first 30 to 45 days, so she's golden now. We have a couple of highlights as far as national legislative update. We at First Five Sacramento signed on with a coalition of supporters for a bill that would double the amount of, we call it MCV, home visiting dollars. These are federal home visiting dollars. Right now, not First Five, but Sacramento County gets about $1 million, goes into Commissioner Kasirie's department for the Nurse Family Partnership Program. So possibility in the future of drawing down more home visiting dollars. So we're excited about that. Keep you posted. In other home visiting news, First Five California last month approved $24 million over the next 5.5 years for home visiting coordination funds. So not to be used for direct services, but to be distributed to county commissions over the next 5.5 years to actually work on coordinating home visiting throughout their county to make the counties be better able to draw down federal and state dollars for home visiting. As you probably know, the CalWorks home visiting dollars started to flow earlier this year. We are expecting additional money from that department, as well as some other things, including possibly now McVie dollars. So First Five California really wanted to position each of the First Fives to take a leadership role in drawing down those funds and coordinating. So we'll keep you posted. It's going to be a non-competitive RFA that should come out in a few months. We're hoping, we think it will be around $100,000 to provide some staffing or consultation work for us. We'll keep you posted on that. Also in First Five California news, currently First Five, sorry, my phone doesn't know what I'm saying. First Five has a program called Impact. And Impact was a 5-year program for $190 million. It's First Five California's major investment in early learning and development. And those funds are due to sunset on June 30th of 2020. So they have recently just approved $103 million for a program called Impact 2020, so Impact 2.0 as we call it. And currently in Sacramento, our funding goes directly to SCOE. So we have, First Five will have the first right of refusal for that funding. So we've already talked to SCOE, and we've pulled together all of our early learning partners and are just getting ourselves prepared to respond to that RFP when it comes out. We believe it will be out in December. Again, a non-competitive. Let's see, in other news, I'm super happy to say that our First Five application, along with our Black Child Legacy campaign partners, was approved by First Five California to have a panel presentation down in LA for their 2020 Child Development Conference. So we will be joined by our partners at Sierra Health Foundation and Her Health First, Sacramento County Office of Education, Mutual Assistance Network, and Chair Cerna will lead off the panel presentation talking about the role of government in this collective impact project of ours. So pretty exciting there. Let's see. Next week, we have several staff attending our First Five Association Summit. There'll be about 175 of our colleagues, and we'll be there to build on our network's vision, our values, and our strategies for deepening engagement across, both within our First Five network and across the network into working with other early childhood partners. Again, our goal with building our network is to influence to build influence and funding for the earliest years. We have news in our First Five Association leadership. So our longtime association director, Moira Kenny, will be stepping down in order to spend more time with her family after the new year. So Moira was really, I think, responsible for taking the association from just a 2-person shop, where pretty much what they did was provide technical assistance to new executive directors and track backfill and funding and revenue into this whole new network strategy. She's going to be greatly missed, and we will actually have the opportunity to give her a good sending off down at the association summit next week, so I'm happy that we can do that. They have just appointed a new interim director, John Sims. He was the First Five Stanislaus executive director for about 15 years and served as the association's president for about 4 years recently. Let's see, bylaw changes. So our bylaw, we brought to the Board of Supervisors some changes, and those changes were approved on November 5th. They redefined commissioner term limits from currently it was 3 2-year term limits, and we are now at 2 4-year term limits. And we also made permanent the superintendent of schools position as a permanent position to the commission instead of a community seat. Also, as a result of term limits, We have several open community commission member seats and alternate commission member seats. So applications for those were accepted through November 19th. And the final decisions on those appointments to the positions will be made by the Board of Supervisors on December 17th. So in just a couple of weeks. I think if everything went according to plan, we had every opening had somebody apply to fill it. So I believe we will have every seat full when we start our January meeting. But the chiefs of staff are working on making their recommendations, and those will go to the board on December 17th. Let's see. As far as the census work, it continues, of course. In November, we participated on a webinar, and that webinar brought together Association, First Five Association, the Head Start Association, and the WIC Association as sort of the three major players of reaching out to parents with children 0 to 5 and providing education and through a trusted messenger on why it's important to count all the children 5 and under. I think I've mentioned before that 0 to 5 are the most undercounted populations in the state. And let's see. Okay, so on November 6th, staff presented a statewide webinar on the topic of addressing First Five sustainability through grantee capacity building. And our staff shared the First Five Sacramento experience of building and implementing and evaluating our certified sustainable program. So there was a lot of interest throughout the state. We ended up sharing out our templates and everything so that other county commissions don't have to build it from scratch. We're just really proud of that program. And finally, in our continued partnership with the Sacramento Business Journal and their online platform called The Hub, we just released our 3rd article, How the Nonprofit Brands Affect Sustainability. And that article had a quote from our partner, Her Health First, and they shared about the benefits to their agency of developing their first ever sustainability plan. And that concludes my report for today.
Thank you. Commissioner Wagstaff?
Thank you very much. Thank you for your report, Julie. The home visiting money sounds very exciting.
Very excited about that.
So have they indicated how much each would get? Do we know how much we might get?
Not yet. And one important thing to note is that not every county is getting those McV dollars right now. So my understanding is that it would do 2 things. It would open it up to some counties who don't have any McV dollars, and for successful programs, they might be able to draw down additional dollars if there's not a taker in every county, sort of like what we saw with CalWorks.
Do you have a sense of timing?
I do not.
Okay, that might be just something to keep us posted on.
For you.
And whether the other question to track, I think, Julie, is whether or not they specify how much specification goes along with the money. For example, do they dictate who does the home visiting and that sort of thing?
Typically, the money comes through the health departments. Right now, that's how it rolls out. Most health departments are either running Nurse Family Partnership or Healthy Families America, but Parents as Teachers is also on the evidence-based list now. And so, but typically this is money that comes through health departments to use as they see fit.
Okay.
Good.
Commissioner Moak?
Just on that note, I can't remember if it was a First Five funded project, but there used to be a thing called the Home Visitation Coordinating Council that was run, I think, out of the Family Support Collaborative, if I'm not mistaken. This could have been back in 2000. This was right at the formation, close to the formation of Birth and Beyond, when Healthy Families America was the model that was chosen to be implemented here in Sacramento. And Nurse Family Partnership, Parents and Teachers. And I mean, at the time, there were, call it 20 or more home visitation models that were all rolling out at the same time due to some of the CPS changes in CPS and family maintenance going away. And so really the community in many cases, with the help of the Family Support Collaborative, helped to bring everybody together. We standardized some paperwork, we standardized tools, intervention tools, tried to get on some of the same data storage. I mean, there was actually a lot that a woman that many people probably know, Nancy Fendyson, helped to, I think she chaired it maybe. I'm kind of looking at Sheila because she was around at that time too. But I would just say there's somewhere some institutional knowledge in this county about how that looked. And the county was there. I think even, if I'm not mistaken, you might have been there, or the state was there. So I mean, it was awesome. I mean, it was really the first time that all of us who were doing home visitation were all like in the same room at the same time talking about the same stuff.
Great.
And it was fantastic. So the fact that that's like coming, I mean, they say all great things come back eventually.
Yeah.
So it's great to hear that there is some money
Yep.
to be used in true coordination fashion.
Exactly.
For those purposes. So
I will do some research. Thank you for
yeah,
that.
the Home Visitation Coordinating Council, I believe, is what it was
Visitation
called.
Coordinating Council. I got it.
Holy, turn back the clock day.
All right. Thank you very much.
You're welcome.
Advisory Committee update?
Do we have anyone here to provide it?
I can do a quick update on it. It was a pretty fast meeting, and I believe that Latina Price gave the executive director's overview and then presented to the group on our first 5 annual report to the legislature, which is on your agenda for later this meeting, and just received feedback and shared with them what our numbers served and that good stuff. That was about it.
All right. Thank you.
Sure.
Evaluation Committee update?
Yes, I can speak to that. We had 2 meetings since the last commission meeting here, and October 16th, and I believe it was November 15th. I think it says 18th on the agenda, but and at the October 16th, one of the things we did was look at the Sacramento Annual State Report, and we'll see more about that shortly, but it highlighted the Certified Sustainable Initiative and the playgroup evaluation. And then most of the November 15th meeting was spent sort of going over the reduction of African American perinatal and infant death report, and we spent a good amount of time going over that, pretty much line by line.
Yes.
And I think that was the bulk of the meeting.
Thank you.
Financial Planning Committee update?
Yes, we met on October 17th and wanted to mention that we do have a vacancy due to Commissioner Jones terming out. So if anyone is interested in joining the Financial Planning Committee, we would love to have another member. We met and discussed staff gave an update on the CalWorks home visiting program, noting that processes are beginning to normalize and become more routine. Medi-Cal administrative activities update was that we are losing a very experienced person with knowledge of MAA from the Child Abuse Prevention Center. There's a new software system called Time Study Buddy that was rolled out in October, and it is taking improvements for efficiencies in completing time studies. We also looked at quarterly financials from September 30th and noted that Prop 10 revenue has not been received from the state for 3 months. Staff is working with other counties in the first 5 of California to try to remedy the slowdown in payments from the state. The committee reviewed the audit report and questioned staff on the Medi-Cal administrative activities revenue and how it's reported. And we made some adjustments based on the audit to have that reported in a different manner and an accrual basis in future audit reports and in future financial statements.
Thank you.
Sustainability Committee update?
The Sustainability Committee met on November 19th, and we reviewed a few things. We talked about some of the legislation that we supported, since the Commission is getting much more involved in systems and policy change and having an impact. So we talked about some of the legislation we supported that actually has been enacted, like the developmental screening and also the recognition of the Family Resource Centers, the definition in the Welfare and Institution Code. We also reviewed the 2020 policy priorities, and which is coming to you on this agenda. We reviewed the certified sustainable next steps for the Commission, and really looking for ways to engage with partners, continued engagement with partners, and also how to get commissioners involved. There's a few ideas out there that will be coming our way. And lastly, the committee looked at how we will update the sustainability plan once the strategic plan has been finalized. So we have a timeline, discuss the timeline and the process that we'll use. That was it.
Thank you.
Strategic Planning Committee update?
I guess that's me. Did anyone send me a cheat sheet, or am I just remembering?
I've got a cheat sheet for you, I think.
Okay. We met a week ago Thursday, on the 21st, and went through all of the, here we go, thank you. Yes, November 1st, we've had 2 meetings. So we met November 1st and then on the 21st. So at the November 1st meeting, we reaffirmed our vision statement and approved a new mission and some revised strategic principles. We approved a prioritization criterion that was used to score each result area, and we reviewed the data that included trends in the community indicators and community priority data and results from the provider and parent surveys that were conducted. And then at our last meeting, we received the results area presentations that included a review of the trends in community indicators and a landscape analysis of each of the result areas, and we scored each result area using the prioritizations criterion that was approved during the November 1st meeting. So our next meeting is on December 13th, where we'll receive funding recommendations for each of the result areas. So staff are going to go back and make some funding recommendations, and the Commission will receive a full update during our January meeting. Any questions? All right.
Approval of Community Connection grants?
Thank you. Alejandra Labrado oversees this for the Commission, and we'll take this one.
Good afternoon, Commissioners. Today I'd like to present to you the new round of CCG groups that we'll be recommending for funding. This is what we know as Round 8 ever since the relaunch of CCG. There were 5 proposals that were received. All but 1 are being recommended for funding. The total amount of funding for these grants is up to $15,980, and these funds have already been allocated with the fiscal agent. So you all have a chart behind you, and as usual, we're going to introduce the groups who are in the audience and ask them to stand as I call their name. The first group is Aloha with Little Hands. This group will meet monthly for parent and child bonding through Hawaiian cultural activities such as dance, music, and arts and crafts. The next group is Empowering Pops from the South Sac Elk Grove area, and this group will provide a support system for families, particularly fathers, to help create an environment where parents can bond with their children. Some of the activities will include play and story time with children, as well as presentations that will help the dads. Yeah. The next group is Interactive Smart Start in the Art and Arcade area, and this group will focus on school readiness activities to create friendships between parents and their children. Through these meetings, they hope to provide parents with new tools to help them interact with their kids at home as well. And the last group is Orangevale Rocks. This project will encourage parents to spread kindness with their children and community in Orangeville neighborhoods through play, arts and crafts, and especially rock painting, rock hiding, and hunting in their community.
Thank you. So we do need to vote on this.
Madam Chair, if I could?
Yes. Oh, yes. Commissioner Wagstaff?
Some background. In your write-up here, you make reference to the panel members consisting of former CCG group leaders. Can you say more about that?
Yes.
Who actually decides on these?
So this is the first round that we did something different. Usually it was the panel members who reviewed and scored the applications were advisory committee members. But what we did is since we've have a couple of years under our belt now, we've had some really great group leaders who want to take their involvement to the next level. So we've actually identified a few former group leaders of CCG who want to continue in their community service and be involved. So we asked them to review and score grants, and it was very positive because they were able to give recommendations based on their experience as group leaders.
Is the amount being awarded here, is this the amount that each group requested?
This is the amount that they requested, and what we do is we review the budget and we sit with them, and although they might have requested that amount, based on our experience and what things cost, we might not give them that full amount, but we haven't had all of those meetings yet. So what you're seeing is just what they requested in their grant. That's not necessarily what they're being approved for.
Well, that's a good point. I would suggest that as we look at these in the future, because when you look at your discussion, you talk about what the panel ranked the applications based on, and there's no reference to what you just said about whether or not it's an appropriate amount of money or anything like that. So I think, and it's clear from what you just described, that is what you look at. So I think a fourth bullet to that effect would be great there.
Okay. Yes, and that is part of the review. The review tool is the budget reasonable? Do you have any recommendations about the budget? And that is something we discuss at our meetings.
My suggestion, Julie,
Yes.
would just be that proposals be reviewed as to whether they provide a clear description about funding will be used and what goals will be achieved.
Absolutely.
Because I'm sure that's what you do, but it's just not indicated here in our document.
Got it.
Thank you.
Thank you.
I have one question. So the recommended amount for interactive Smart Start is 5,000, but on the grid below, it's a different number. Is that? It's 4963.
Might have been a mistake. Yes, so the requested amount must be the 4,963. Yeah.
So that'll be the amount we're approving then? Okay.
Just put out a card.
Yeah, you need to just fill out a slip and bring it up here, and then, yes, then you can.
Okay. Sorry, I had a question earlier, but I didn't want to interrupt anything. Our speaker slips in the bottom.
Yeah, just fill it out.
Okay.
Fill it out, and then we'll call you up here. No, that's fine. Commissioner Moak.
That's fine. Any other questions? I just want to just say thanks again to the staff, to First Five staff. I know that this program obviously now has been going for a long time. Took a little break and then comes back. It's tremendous to hear that there are former grantees that are now involved in almost the direction and visioning and selection of the future is insane to think about, and exactly what this program was intended to do at the beginning, right? Take if I'm not mistaken, 0.002% of our budget overall, right? If I'm not a good, the math guy's there, but I'm pretty sure this is, it's 0.002% of our annual budget allocation to go to community projects that are going to be doing real work with real people and real communities. So it's just, so kudos to all of you who are being selected and granted this opportunity to lead your community to new heights, and awesome to hear the people who are wanting to stay involved in a meaningful way in the selection. That's just absolutely exactly what this program was designed to do. So kudos.
We're excited about that.
Excellent. Commissioner Wagstaff?
I was just going to comment on what Scott just said. I just go back historically. Yes, it's a very small amount, but I remember very well the critiques we got on these back in the old days. I forget how far back it was.
10 years, I think.
Yeah, I
almost.
think it was. Well, I'm not going to show my age. But anyway, so that is a point worth taking, but I still think it's very important to
Yes, okay.
add the kind of review these things get. And so we can head off any sort of questions along those lines.
Yep.
Do we have a speaker on this topic or a different topic?
Different?
Different topic?
Right now. Sorry.
Okay, no, that's
I
fine.
was is the first one, so I'm not sure how it works. I didn't know all the
Yes.
stipulations and bureaucracy of it, but
No problem.
apparently it's going to take a lot longer to discuss. Like, I saw a nonprofit in the morning. I don't want to take too much time, but they actually, she started a nonprofit herself to take, to like give homeless people food herself, and then is taking donations and doing nonprofit. So it's kind of like what you guys are doing, but as a nonprofit, they don't have to go through the bureaucracy you guys have to go through.
So should he fill that out and then?
Yes.
Well, yeah,
For
fill it out
next
and then we'll
time,
hear
'cause
from you
I haven't read
officially.
any of this yet, you know what I
That's
mean? So
okay.
I don't want to sound stupid, but it was.
No,
I'm
that's why
interested in-
public comment is fine, and just fill it out and then we'll get you up here. All right, we do need to vote to approve these grants.
Dave Gordon?
Aye.
Oh, wait, do I need a motion?
Oh,
Yes, I need a motion.
Move staff recommendation.
Oh, is it just a staff recommendation? Is that?
Yes.
Okay, all right. Go forth then.
I'll second it.
Oh, yes.
Dave Gordon?
Aye.
Beth Hassett?
Aye.
Kathy Cossack?
Aye.
Bruce Wagstaff?
Aye.
Scott Moak?
Aye.
Patrick Kennedy?
Aye.
Motion passed.
All right.
Public hearing, review and adoption of annual report for fiscal year 2018-2019.
Carmen Garcia Gomez is our lead on this, and we'll take it.
Good afternoon, Commissioners. As every year, we come before you for a public hearing on the review and adoption of the First Five Sacramento Annual Report to First Five California. This report was submitted at the end of October. We didn't have a meeting in November, so we're coming to you today for your review and adoption of it. In your packet, you have a couple of attachments, which include the complete report to First Five California. As Children and Families Act of 1998 requires that California's 58 county commissions submit an annual report by November 1st of every year, we submitted ours on October 30th of this year. The reporting forms include Section 1, which is the AR1, County Revenue and Expenditure Summary, Section 2, the County Demographic Worksheet, and Section 3, the County Evaluation Summary. Under Section 1, County Revenues and Expenditure Summary, we see that our expenditures for 2018-19 totaled $20.6 million compared to $23.1 million from the previous year. Our year ended with a fund balance of $28 million. Section 2 includes the County Demographic Worksheet. Something very interesting that we saw this year was that this is the first year of our new strategic planning where we made reductions. And so we served over 44,000 parents, children, and providers, and that was about a 20% reduction from previous years, which coincides with about the amount that we reduced back in 17-18. The unduplicated number of clients served was over almost 20,000, and that includes children and parents. Not providers. We don't count providers in that manner. The following tables provide a breakdown of the ethnic background and languages spoken. This doesn't really change. We're still serving about the same amount, the same percentages in both ethnicity and languages spoken, with Hispanic, Latino 34%, African American 19%, white 16%, Asian 11%, multiracial 8%, and other is 12%. As Commissioner Wirtz stated earlier, in Section 3, which is your county evaluation summary, it includes the evaluation activities, findings, and highlights. We highlighted in that section our sustainability evaluation that was conducted by ASR, and we also highlighted our playgroup evaluation for the school districts. The staff recommends that the commission conduct a public hearing, which we're doing today, and adopt the fiscal year 2018-19 First Five Sacramento Commission's annual report. This concludes my report.
Right. Do we take commissioner comments first and then open the public hearing? Okay. Commissioner Wagstaff.
Thank you very much, and thank you for your report. A couple of questions. So first of all, the fund balance of 28 million, how does that compare to previous years? Is that the normal amount that we have in reserve, or is that
No,
stand out?
typically it's being reduced.
Beg pardon?
We have a planned spend down as part of the 2018 strategic plan, so it reduces every year.
Does the state commission require a certain level to be left in reserve?
They do not, but we here have a personal or an organizational policy of 3 million at the end of our planned spend downs.
But we got 28 million here.
Correct.
So I just couldn't help but note that we've had a 20% reduction in number of people we serve, but we're not spending 28 million that we could be in the community.
This was also the first year of the 2018 strategic plan in which we reduced by 25% our budget, how much we are
Because of the cliff that's approaching.
Yeah, exactly.
Yeah, well, I just couldn't help but note that 20% reduction in number of people we cover, but we've got this money that we're not spending that we could use to cover them.
So the 28 million is for future years uses, so it includes what our budget is for this year as well as for the next 2 years up till the
2021 strategic plan, which we're looking at about a 25 to 30% cliff in the year
Right.
2021. When we hit the end of that cliff, we will be pretty close to just the $3 million in the bank, which is our policy.
So Julie, what you're saying is, I guess, part of the reason here, or a big part of the reason is in preparation for that cliff that's
Correct.
approaching.
The commission is, and this is probably before you joined, but had made a decision to do a series of step
Right.
downs rather than one enormous cliff that would do that. So we had talked about doing a 5-year strategic plan with a much bigger hit and a bigger cliff, but the commission had decided to do a series of 3-year step downs, which
Okay,
keeps the
that's
funds
helpful.
in the bank a little bit longer, and then allows us the opportunity as we see emerging issues or things that we might want to invest in. It would mean that all of our money wouldn't be tied up in a 5 or 10-year plan.
That's very helpful. One last comment on the evaluation section, attachment 1, really good write-up here on the sustainability efforts, which definitely was a highlight this year. But I don't see anything else about the other evaluation activities that the evaluation committee is reporting on every time. They're
Yes.
doing some great work.
I can explain that. So First Five California gives us a very small amount of characters to include. I think in this section is like 1,000.
Like a term paper, you mean?
Yes, so, and it also includes not just numeric and alphanumeric, it includes periods and spaces. So we can only select.
Boy, that takes me back.
Yeah, so we can only select, not necessarily our biggest accomplishments, because I would consider that we have many, many big accomplishments. But this was a specific evaluation that we did this year, and I thought it was very important to highlight it because it has caught the attention of so many other commissions. I thought it was a really nice way to not just, have it at our office, but to share it.
It absolutely was. It absolutely was. I just know that Commissioner Wirtz's committee does a lot of good stuff in evaluation that I thought worth noting. I didn't realize you were so prescribed in, spaces and all that stuff.
Yes, yes, we are.
Very interesting.
But good news is that in about March of next year, you will receive a full evaluation report on all of our outcomes.
Thank you.
Commissioner Wirtz?
Thank you. The other thing, Bruce, that I would add is that the whole sustainability committee was part of this step-down process and a very thoughtful process of saying, do we fund all the needs that we can fully until we run out of money, and then everyone has to just find their own way. This, obviously, the sustainability piece is really to give people time to build that sustainability. And I think we've done an incredible job of moving in that direction. So that's real kudos to that. And secondly, our committee, the evaluation committee, has 5 great members on it, and each of them play a major role in helping in that process. So I just wanted to, I certainly like to claim credit for the committee, but I'm just one of the team. So, and then finally, my question has to do with just asking clarification around the deduplication or the non-duplicate count. Can you review that again with me?
Yes.
And perhaps show me where, if it's in the document itself here.
They basically ask, okay, we give them the 44,000 or over 44,000 count, which it includes all of our programs that we serve. Many of our programs collect client-level data directly into Persimmon, so we have actual identifiers, but then we have a lot of other programs that don't collect that information, and it's more of an aggregate number. So that's why there's a duplication, because obviously some of our clients, a lot of our clients are served through various programs and various programs that don't necessarily collect identifying information. So the state just asked for an estimate of what we think the duplication is. So when I run our numbers in Persimmon and think about all of the programs that also serve, for example, we have Early Smiles, which goes to many of the preschools that we fund, all of the preschools. Well, we also look at, and we also count those children in this report. So I look at our numbers, and then I just apply a percentage.
And that's the 20% on the...
Correct.
I can't figure out what page, on page 2 of the AR2.
Correct.
And then, as we've mentioned before, there are other services that First Five does that don't get included in this at all. And we've talked about, obviously, the fluoridation one being a big one, but also the baby-friendly hospitals. And so this number of 44 is what gets captured in Persimmon, and that's useful and valuable for us in evaluation, but it doesn't fully cover all of the families served, obviously.
Correct. And when we look at our local evaluation report, we will address that. We also provide services to so many other families, children and parents that are not calculated in this number, and then we identify those programs.
Got it. And now Persimmon does allow us to track some of those families that get more than one service.
Yes.
Yeah.
Yes.
And in our evaluation, we're interested in seeing if multiple services have a larger impact with families than single service kind of situation. So, thank you very much.
You're welcome.
Oh, and just the final, we did talk at the evaluation committee as well around the pick of the play groups as just one of the highlights from the evaluation effort. So we recognize that was a choice to just highlight a good effort at evaluation. Thank you.
All right, this is a public hearing. Open the public hearing. Seeing nobody from the public wanting to speak. Close the public hearing. So we do need to vote on this to adopt the annual report.
I'm happy to second.
Okay.
Dave Gordon,
Aye.
Beth Hassett,
Aye.
Kathy Kossick,
Aye.
Bruce Wagstaff,
Aye.
Scott Moe,
Aye.
Patrick Kennedy.
Aye.
Motion passed. Public hearing, review and adoption of the fiscal year 18-19 financial audit.
Good afternoon, ladies and gentlemen of the Commission. My name is Eric Harold, Chief of Administration, First 5 Sacramento Commission. The fiscal year 18-19 audit was conducted by a new independent auditor called Macias, Genie, and O'Connell, or better known as MGO. We have today with us Kevin Starkey, a partner at MGO, to present the audit report.
Well, I'm assuming it's on. Excuse my voice. I came down with the flu after coming back from Tahoe over the weekend. So good afternoon, Commissioners. It's a pleasure to be here. I'm a partner with MGO, Kevin Starkey, out of our Sacramento office. I'd first just like to say thank you to the Commission and their staff, as well as the county finance staff that may be here, for their hospitality and readiness, what have you, for the audit process. So thank you. And then I would like to thank my staff as well. Scott Brenner, who's sitting here in front, he's a director with the firm, Bunty Catan, who's a manager, and Kathleen Foster, who's a supervisor. So this is our first year conducting the audit for the Commission. So we're under a kind of a larger contract with the County of Sacramento, and as part of that, we conduct the annual audit of the First 5 Commission. So hopefully before the Commissioners, you should have 2 reports. One is the audit report, which contains 3 opinions that we provide, and as well as what we call a required communication letter, which is kind of just a loose leaf document. So I'll start out at kind of a high level. So the results of the audit ended up in an unqualified, unmodified, or a clean opinion. And so as auditors, when an entity procures to have an audit performed, that is the highest level of assurance that we can provide as auditors. So what that means, in effect, is we have conducted the audit of the financial statements as prepared by management, and we concluded that those financial statements materially present the financial position or the balance sheet and the profit and loss statement of the organization in accordance with the underlying accounting standards. We did have what I would call an internal control finding as a byproduct of the audit this year, which I will talk about a little bit later, and it is included in one of our reports. So our opinion is on page 1 of the document and goes on to page 2. I'll turn your attention to page 33, which is the second of our reports that we issue. So because this audit is conducted in accordance with government auditing standards, which is required pursuant to the underlying audit guide, if you will, that the State Commission has put out, we have a responsibility to report on the internal control of the organization over its financial reporting. And so during the course of the audit, we did come across it's not a material item, but certainly worth bringing to the attention of management and to those charged with governance. And it was associated with receivables, and specifically how the Commission was accruing and recognizing revenue as it relates to a specific revenue source that they receive, which is through the Department of Healthcare Services at the state level for some Medi-Cal assistance program. And so we had recommended that the Commission accrue the additional revenue that was due to them, or receivables, which was probably going back, I want to say 4 or 5 quarters, if I recall. So what you have before you are financial statements now that really show more on a full accrual basis what the revenues, expenses, and associated liabilities and assets look like. Because what you had in prior years specific to that one revenue source, because it took such a long time to receive those receivables, they were not being accrued. And so they were basically being accrued upon submission of the claims as opposed to when the other underlying expenses are incurred. And so it really resulted in about a $200,000 difference if we look at year over year what the impact would have been on equity of the organization. So we certainly did not feel that that was significant enough to go back and restate and correct prior financial statements that had been presented. So it kind of just flowed through the current year operations as a byproduct of that. And so again, just to reiterate, it was not a material instance of internal control, but just, as I mentioned, something to bring to the attention of management and certainly those charged with governance. I would just take you through the financial statements briefly. And really, I'm going to focus on the section of the report that's titled Management's Discussion and Analysis. So this is an area of the report where management kind of provides their insights as to the significant balances and the changes in those balances from one year to the next. I think there's already been some discussion previously about probably some of the changes. One being, it looks like equity's gone down by $4.5 million, and that was clearly, it sounds like, intentional as a byproduct of the strategic plan that was adopted and implemented. So if you look at page 4 of the report, this is a comparison of 19 to 18 results. And you can clearly see that change in net position or fund balance, depending upon how you want to look at it. But certainly on page 4, the net position went down almost $4.2 million. So as has been previously discussed, that was intentional to kind of draw down and use up some of the cash that the commission was sitting on, and really kind of move some of the programs forward and spend down that equity or that fund balance. One of the other changes you'll see if you look in the asset section, clearly the current and other assets went down by $6.5 million. That really is the cash, the spending of the cash. The due from other governmental agencies is what I alluded to earlier, about a $1.5 million increase from prior years, and that really speaks to the recording of those receivables that were not getting reflected until the submission of the claims were being made to the state. And so we made the recommendation that really those should be accrued and recognized when the underlying expenses are being incurred. So that's, I would say, probably the most significant changes, year over year. We do have to test on a number of areas related to compliance with the state audit manual. And I would turn your attention to page 35 is where we have that report on the organization's compliance with the state audit guide, if you will. And happy to report that we had no issues from a compliance perspective related to how the commission was carrying out the activities of the organization. And you can see kind of down toward the bottom of page 35, we have listed out the various areas of compliance that we have to look at pursuant to the audit guide. So you've got some contracting and procurement areas, conflict of interest, ordinances, long-range financial plans, financial conditions, and then you've got some program evaluation. So within each of those areas, we test for compliance against the requirements that the state has established. And again, there were no issues that we came across from a compliance perspective. So kudos to the commission staff. So with that will conclude my presentation. Hopefully tried to keep it, not getting into the weeds, and keep it high level. Certainly if there's any questions, I'd be happy to address those. So thank you very much.
Thank you. Again, this is a public hearing, so we'll open the public hearing. Any speakers? Okay, we'll close the public hearing. And we need to adopt the fiscal year 18-19 financial audit. Do we have a motion? Oh, Steve Wertz.
Sorry, if I can make a comment, actually a question. If I could just ask our financial committee chair if you would speak to the same issue that you mentioned, the accrual before, but just your considerations from the committee in reviewing this?
Yes, it's basically a reporting issue and a recording issue. So it's recording a receivable in a timely manner. It's a timing issue more than anything. So we discussed it at the committee, and staff understand why it needs to be done in the future. It's not a significant issue, but it's being corrected.
Well, not being a financial person, just because it doesn't make good sense to me. I mean, because I don't understand that. But because if you say you've got the money, but you actually don't have it, if I understand that right, we did what we needed to do, and we're owed the money, but it's not coming to us. Not having that show that, or having it show as is being there, seems a little problematic to me. But again, that's why I was deferring to yours.
It's a receivable to be received. So you're recording it in a timely manner to be received in the future.
Even though you haven't yet received it?
Yes.
Okay, yeah. And I defer to
It's effectively an
better
asset.
minds.
Yeah, it's an asset of the commission. And so because if you look at it from the standpoint of the expenses have been incurred and paid out, so therefore the cash has kind of left the organization, but because it's more of a grant and a reimbursement basis, the underlying asset that's still due to the organization should be recognized as well. Yeah.
And I understand that as to be received. It helps clarify that for me,
Right.
so thank you, sorry.
All right, any other comments? Do I have a motion to approve the audit? I will move it.
second.
Okay.
Dave Gordon,
Aye.
Beth Hassett,
Aye.
Kathy Kossick,
Aye.
Thank you.
Bruce Wagstaff,
Aye.
Scott Moak,
Aye.
Patrick Kennedy.
Aye.
Motion passed. Approve the 2020 First Five Sacramento policy priorities.
All right. So our policy priorities were first created in 2016 by our Sustainability Committee. One of the very first things we did was say, hey, if we're going to start taking positions and having staff allocate work time toward policies, then we should definitely create a policy platform that we would follow. So we did that, and each year we bring it to you with some slight updates. We reviewed this at our meeting earlier or last month, and we actually did not have any updates. So the 2019 policy priorities are the same as the 2020 are the same as the 2019, but they are here for you, and we break them down by each of our strategic plan priority areas. So health, early care and development, empowered families, and then systems change and sustainability. So we're asking for your review and approval of them for 2020.
I'll move to approve.
Second.
Need a roll call for that?
Who's second? Who was the second? Okay.
Mr. Kennedy.
Mr. Kennedy.
Dave Gordon,
Aye.
Beth Hassett,
Aye.
Kathy Kossick,
Aye.
Bruce Wagstaff,
Aye.
Scott Moak,
Aye.
Patrick Kennedy.
Aye.
Motion passed. Approve the 2020 calendar.
Great. So much like the current year, our 2020 calendar has us meeting 7 times throughout the year. We did end up canceling our November meeting for 2019, but I've kept it on in 2020. We're doing more strategic planning work, and just wanted to have that option for a meeting then. So asking your approval of this calendar, and then we will go ahead and send out meeting invites to you and get them on your calendars.
All right, I'll move approval.
Second.
Dave Gordon,
Aye.
Beth Hassett,
Aye.
Kathy Kossick,
Aye.
Bruce Wagstaff,
Aye.
Scott Moak,
Aye.
Patrick Kennedy.
Aye.
Motion passed.
I forgot to say one thing, I'm sorry. The attachment following the calendar is our best guess right now as to what we would be covering on each agenda for that 2020 year. So you can kind of see where we're going to have some strategic planning things put in when we bring you the various required mandated things for you all to approve, as well as our new stuff.
Nomination and approval of the 2020 vice chair.
Great. So each year about this time, we also ask for your nomination and approval of a vice chair. I didn't hear from anybody reaching out, so I just reached out to our current vice chair, Commissioner Hassett, and asked if
Move
she would
approval.
be so she would be willing to continue on in that role. She has graciously agreed to do so if you all will have her.
All right.
Like
I'm not
I
going to
said,
move
I
myself.
will- I'm happy to move approval of Beth being the absolute.
Dave Gordon,
Aye.
Beth Hassett,
Aye.
Kathy Kossick,
Aye.
Bruce Wagstaff,
Aye.
Scott Moak,
Aye.
Patrick Kennedy.
Aye.
Motion passed. Commission member comments?
Should we do our public comment.
Public
Is
comment.
he gone?
Yeah, I watched them leave.
Oh, okay. All right, any commission member comments?
Just a suggestion, because that was his first time and he seemed not to know the process and so on, and I'm wondering if it, and because we have public comments right at the first item, I'm wondering if we could have taken him in lieu of not having fit him in at the beginning there, when, just partly because of, and the problem is, of course, that someone doesn't wait around or doesn't feel comfortable doing that. I'm just wondering if we might take advantage of any public input we can by facilitating that. I'm not sure if that fits the rules or not. He didn't have a statement at the initial part of the meeting, but he was looking for a place to make his public comment. So I'm just wondering if that flexibility exists.
And it does. Public comment can be taken, well, on an action item, public comment has to be taken prior to the action.
Yeah.
But general public comment, which it sounded like it was an off-agenda item,
Yeah.
certainly the commission could accommodate a speaker who wanted to come and give an off-agenda. We just know that it was an off-agenda public comment taken out of order,
Right.
if the commission so wishes.
And I guess I would suggest that we try to do that in the past. I'm not sure. That's just a general recommendation, I think.
It's good.
Yeah.
Yeah, that's good. And we used to have public comment at the end of the meetings, and we moved it forward so people didn't have to wait throughout. But it's nice to know we have that flexibility to bring folks in anytime.
Thank you.
All right. I have no other requests to speak, so we will close this speedy little meeting at 1:32.
Wow, record time.
This is why you're the best.
Yes.
Vice Chair.
Got you and your family feeling better?
We are. I mean, I still have a little residual cough. That's now a week and a half into that.
Okay. Oh, can I have your,
The report, because
So,
I
yeah.
was thinking I needed.
Rick always gives me his sheet so I can compare.
That's perfect.
I got it. Like, it was
Oh, okay, that's fine. It just helps sometimes, you know.